This is again a very common question. And yeah, it is a major surgery. No surgery is simple surgery. All surgery has to be done for a reason, and it has to be done safely and properly. And if you take care in a fit adult to perform breast reconstruction surgery, when you say major, there is never a risk to life or death, that kind of risk ever. Because what we are doing in breast reconstruction is removing the breast, which is an organ which is just under the skin, and we are removing fat from another place. So it's all surface surgery. It is not into the bowel or into the lung or that kind of thing. So in that way, it is not life-threatening surgery, but any surgery has to be respected and it has to be done properly. Very simple option to start with is using an implant. So in some patients who have very good quality skin, and it all depends on the skin the breast surgeon can leave behind. So I'm a breast reconstruction surgeon. So there is a breast surgeon who removes the breast. At the same time, I move in and I rebuild the breast before the patient wakes up. So it depends on the skin of the breast which is left behind. If the quality is good, we can use an implant at times. If the patient is going to have radiotherapy after the operation, then we can't use implants because the implants go very hard and they need repeated operations. So it's not a good operation. So in select patients who do not have radiotherapy and they have very good quality skin and the breast is not too big, then implant reconstruction is a type of reconstruction we offer. Other than that, almost all patients who have some fatty tissue in other parts of the body, we can use that tissue to rebuild the breast. That is the flap surgery. And this is the best form of reconstruction because this lasts forever. It is with the patient's own tissue. It's durable. It ages with the patient. If the patient puts on weight, it swells. If the patient loses weight, it reduces. And you don't need to do maintenance surgery like for implant surgery. So these are the types of reconstructions. Yeah, belly fat is the best source for breast reconstruction because there are many issues here. One is there is usually, if the patient has had 1 or 2 pregnancies, there's enough skin and fat, we can take and make the tummy much flatter and nicer looking, and at the same time use the tissue to rebuild the breast. This is the commonest form of tissue rebuild being done around the world now. I personally would be doing maybe about 250 of these a year. So that is the kind of volume people are doing. Another reason for this is it is one area where we can take the fat from at the same time as the breast surgeon doing the mastectomy. So the patient is flat and we don't have to take it from if we need to take the fat from the back, we need to turn the patient after the mastectomy and replace the patient. So here it is in one position. So there are many advantages, and yes, belly fat is a good area to make a breast from. Yeah, almost always we'll use drains after a mastectomy and reconstruction. There will be a drain in the breast. There might be a drain in the armpit because sometimes they will clear the lymph nodes at the same time. And then there'll be a drain either in the tummy or the thigh, wherever the tissue is taken from. Usually, in the first 2 days, all drains will be out. And the patient will be discharged from the hospital by about 4 days. So that is the usual sequence. With regards to recovery, by the time the patient leaves the hospital in 4 days, they'll be having a shower. They will be walking up and down the stairs. So they'll move around the corridor. But and they can look after themselves. They don't need a carer to sit next to them when they go home, that kind of thing. But they won't be able to run a household. They can't care for the other people in the house. So somebody has to look after the household, and the patient can usually, for the first 2 weeks, we recommend the patient just looks after themselves. And we allow them to go for long walks, but not get into a car and travel, that kind of restrictions for 2 weeks. And after that, they can start moving about a bit more freely going out and so on. And about 6 weeks, almost all activities they can continue. Of course, in the National Health Service, the breast reconstruction is available for all patients who are having mastectomy. In the private sector, most often the patients who come to us are insured patients. So the insurance company will pay. But sometimes we get people from abroad or even local people who do not have insurance seeking private self-pay model. A breast reconstruction using abdominal tissue, that is tummy tuck kind of breast reconstruction, along with the mastectomy and all the lymph node clearance and everything, it might work somewhere near 25 to 27,000 pounds, I think. That is the kind of range the hospitals quote.